Good afternoon. My name is Jordan Garcia. I'm going to be performing my IM and Subq checkoff for you today. So we're going to be performing that on patient Anna Powolowski. I'm going to start off in the med room. I'm going to pull up her MAR on the computer and I'm going to verify the patient and the MAR is correct, as well as the MAR matches the orders that the physician ordered. So I have my patient med chart right here, my computer. I'm going to verify her name, Anna Powolowski, her date of birth, 5/5/1957. Her allergies are penicillin and her reactions are hives. I'm going to then go and check the vaccines that the doctor has ordered. So the first vaccine is going to be the influenza vaccine, 0.5 mLs, to be given 5/11/2020 at 14:58. And the next one is the vitamin B12 subcutaneous injection, 500 mcgs, 5/11 at 14:58. So I know that I'm going to have to be converting the 500 mcgs to milligrams because it's dispensed as milligrams per ml. So I already know I have to do a calculation with that one. So I have, I verified the patient, the MAR is correct. Now I'm going to go ahead and retrieve my meds. So the two meds that I'm going to pull are the influenza vaccine and the vitamin B12 injection. I'm going to now go ahead and do my first check. I have the right patient, Anna Powolowski, 5/5/1957. I'm going to go ahead and now do my 5 rights for my IM injection, which is the vaccine. So I have right patient, right med, influenza vaccine, right dosage is 0.5 mLs, right route is intramuscular, and right time is 14:58. So that's the right one. I did my first check on that one. Now for my second check, I'm going to do the vitamin B12. So I have the right patient, Anna Powolowski, 5/5/1957. I have my right med, which is the vitamin B12 subcutaneous. I have the right dose, 500 mcgs, and I'm going to go ahead and do my calculations now. That way when I go to draw the medication, I already know what to draw up. So 500 mcgs converted to milligrams is 0.5 milligrams, and so since it's dispensed as 1 milligram per 1 ml, and my dosage is 0.5 milligrams, I'm going to be pulling 0.5 ml. So for both of my medications today, I'm going to be drawing up 0.5 mLs. So I have my right dosage, my right route is subcutaneous, and the right time is 14:58. So I just did my first check for both of my medications, and everything is correct. So I did my first check. I am now going to check for expiration on my medications, make sure neither of them are expired. I'm also going to check them for any cloudiness in there, as well as any particulates floating in the vial, and they don't have anything, so they're both good. They're both non-expired. For these, if this was the first time that I was using the vial, I would also label them with the date and time, as well as my initials, so that they know that I'm the first one who used this one. And they also know, when they expire and to stop using them because of the date. So I would label them with that. Then I would do any calculations. I already did that. Then I would go ahead and do my second check before I pull the medication. Anna Powolowski. The first one is the influenza vaccine, so the right drug, the right dose is 0.5 mLs. The right route is intramuscular, and the right time is 14:58. And then for the vitamin B12 subcutaneous, Anna Powolowski, 5/5/57, right patient, right med is the vitamin B12. Right dose is 0.5 mLs. I've already done my calculation to know that. Right route is subcutaneous, and right time is 14:58. So I just did my second check. Now I'm going to draw up my medications. So today I have all of my supplies that I'm going to be using. I'm going to gather those as well. So I have my medication, I have my needles, I have my syringes, I have my gauze, I have my gloves, I have my alcohol swabs, and I have my sharps container. Okay, so now that I have all of my supplies gathered, I'm going to go ahead and start drawing up my medications. So I'm going to start with my influenza vaccine. I'm going to draw that one up first. And for my influenza vaccine, I'm going to be using the 23 gauge and 1 inch needle. And I'm also going to be using a 1 ml syringe. Usually I would because it's less than 1 ml. But I don't have a 1 ml syringe, so I'm going to be using a 3 ml. And then for the subcutaneous, I'm going to be using the 25 gauge and 5/8 inch needle. And then for that one, I'm going to be using the only 1 ml syringe that I have. So those are my needles and my syringes that I've decided to use. So like I said, I'm going to start with my intramuscular one. So I'm going to go ahead and sanitize my hands because I've been touching everything. So I'm going to go ahead and sanitize my hands. And then I'm going to go ahead and let me point this down so you can see what I'm doing. I am going to go ahead and over my alcohol swab, and I'm going to cleanse the top of the stopper with this so that it's nice and clean. And then I'm going to get my 23 gauge needle and my 3 ml syringe. And I am going to do the rainbow cap, and then I am going to pull back the same amount of air into the needle as the dosage. So I'm going to pull back 0.5 mLs of air. I'll go ahead and do that now. I'm going to do the rainbow. I'm going to set this over to the side so I can do my one-handed scoop. So I'm going to now draw back 0.5 mLs of air. And when I'm pulling it back, I'm going to be careful not to touch the plunger, just the little lip right here, so that I don't contaminate the plunger, because I don't want it to go into the patient. So 0.5 mLs of air. And I'm going to do it at eye level so I can get it correct. Okay. And then I'm going to insert the needle into the vial, and I'm going to inject that 0.5 mLs of air to air, so air to air. Again, not touching the plunger so it doesn't contaminate. Okay, now I've injected the air to air. I'm going to flip it and pull back 0.5 mLs of the medication. Again, not touching the plunger so I don't contaminate. And as I'm pulling back, if I get any air bubbles in the syringe, I'm going to just flick it gently to tap the air out. And again, I'm doing this at eye level so I can make sure I get an accurate dosage. Okay, I pulled out my 0.5 mLs. Pull it out, and I'm going to go ahead and do the one-handed scoop. And then now that I've drawn this one up, I will go ahead and label it with the patient's name, patient's date of birth, the medication, the medication name, the dosage, the time, and my initials. And I would set this aside right here. Now I'm going to go ahead and draw up my second one, my subcutaneous vitamin B12. So for that one, I have the 25 gauge needle and my 1 ml syringe. Same thing for this one. I'm going to cleanse the top of the cap. And then I'm going to do the same thing, pull back 0.5 mLs of air into the plunger, and then inject it air to air, and then pull back my syringe. Again, I'm going to set this to the side so I can do the one-handed scoop. I'm going to pull back 0.5 mLs of air. Okay, perfect. And then I'm going to inject air to air. Again, not touching the plunger because I don't want to contaminate. Okay, and I'm going to flip. Again, pull back 0.5 mLs without touching the plunger because I don't want to contaminate. And again, if I get any air bubbles, I'll just flick them out. And I'm doing this eye level so that I can make sure I'm getting it accurate. Go to sleep there. Okay, now I've drawn out 0.5 mLs in here. Go ahead and pull out and do the one-handed scoop again. Okay, and then again, I will label this one with the patient's name, patient's date of birth, the medication, the dosage, the date and time, and my initials. And then I will go ahead and set that to the side. I'm going to go ahead and bring these 2 vials with me so that when I start the patient, I can put in the lot number and everything like that when I scan their ID code and everything, or their barcode on their ID and everything. So I have my medications and my syringes, I have my vials, I have the rest of my supplies, and now I'm going to go ahead and go into the patient's room. Okay, so I'm at the patient's room now. I'm going to go ahead and knock on the door. Whenever they say come in, I'm going to go ahead and immediately wash or sanitize my hands. I'm going to identify myself to the patient. Hi, my name is Jordan No, they don't need my last name. Hi, my name is Jordan. I'm going to be your student nurse today. Can you please tell me your name and date of birth? Anna Pawlowski, 5557. Okay, Miss Anna, and do you have any allergies? Hives, and what are your reactions? Hives, I said that wrong. My allergy is penicillin, and what are your reactions? Hives. Okay, and that matches her chart here, so I have the correct patient. That's good. Okay, Miss Anna, what I'm going to be doing today is I'm going to be giving you 2 injections that were ordered by your doctor, but first I'm going to go ahead and make sure the area is safe. So I'm going to make sure that your bed is in the lowest position. I'm going to make sure your side rail is up. I'm going to make sure you have your call light. I'm going to make sure, like, if you have any walking aids, they're next to your bed. There's nothing on the floor to trip you up or anything like that. Once I make sure all of that's safe, I'm going to go ahead and shut the door and shut the curtain to provide privacy. So I'll shut the door and blow the curtain. And then I'm going to go ahead and teach my patient about her medication. So I have my drug cards to consult for her reactions. So I'm going to ask her, has she ever had them before? If yes, has she had any reactions? And then where she gets them. So for the subcutaneous injection, there's 3 main spots that you can give the subcutaneous injections. The first one is in the lateral posterior aspect of the upper arm. That's back here. The second one is the abdomen from below the costal margins and then above the iliac crest, so like right in this area. They want you to avoid the outer 2 inches of the umbilicus area. So you do like your 2 fingers here, and you want to go outside of that. So usually like right here is where you'll do it on the abdomen. And then the third spot is on the anterior aspect of the thigh, so this front part of this thigh. There's also 2 alternative places that you can do it. So you can do it on the scapula, or you can do it on the upper ventral or the dorsal gluteal area. So like your back fat area, pretty much, is where the alternative site is for those. And that's for subcutaneous. So those are the 3 main sites for subcutaneous. For IM, there's also 3 sites. So the first one is going to be your deltoid, and you're going to look for the bony prominence on their arm right here. And then you're going to do 2 fingers down, and then you're going to make an imaginary triangle on their arm up here. And that's where you're going to do it, the IM injection in the deltoid. Then for the next one, let me get my little thing right here. For the next one is going to be the ventrogluteal. So say this is their thigh. And your thumb is going to be pointed towards their groin. And then your first finger right here is going to be over the anterior superior iliac crest. The middle finger is going to come out and make a V. And then right here in this V is where you're going to give the IM injection in the ventrogluteal. And then next is the vastus lateralis. So if this is their thigh, you're going to take their thigh in between your 2 hands. This one is going to be your knee, the knee. This hand is going to be the knee. And this one is going to be over the femur, what is it called? The greater trochanter. Yeah, this one's going to be over the greater trochanter. And so in between these 2 areas, in between here is going to be where you're going to give the other IM injection in your vastus lateralis. So those are the 3 sites for your IM injection. So as I'm educating her on her med, I'm going to ask her, where do you usually get your subcutaneous injection, your vitamin B12 injection? And she'll say her abdomen. I'll say, okay, well, last time you got the injection, where did you get it? Did you get it in your abdomen on your right side or in your abdomen on your left side? She'll say, my right side. I said, okay, well, this time I'll do it on my left side because you want to rotate sides so that you don't get any, bruising or anything like that. And then I'll also ask her, have you had any, reactions to your influenza vaccine before? She says no. Okay, well, just in case I'll consult my drug card now. Just in case some adverse reactions are soreness at the injection site, fever, or myalgia, which is overall generalized body weakness. And as far as any adverse reactions to your vitamin B12, have you had any reactions? No. Okay, well, just in case, some reactions are, again, soreness at the injection site, rash, erythema, which is red skin around the injection site, dizziness, headaches, or like dark red urine, stuff like that. So then once I've taught her about her medications, I will go ahead and do any patient assessments that I need to do for that. I don't really need to do any patient assessments for these. So I'm going to go ahead and now do my 3rd and final med check. So I'm going to start with my influenza vaccine. I have the right med, the influenza vaccine, the right patient, Anna Powolowski, 5/5/1957. Right dose, 0.5 mLs. I've already have it drawn up. Right route, intramuscular, and right time, 14:58. So I did my 3rd check on that one. I'm going to go ahead and do my 3rd check on my B12. I have the right patient, Anna Powolowski, 5/5/57. I have the right med, vitamin B12. The right dose is 0.5 mLs, which is when I did the dosage calculation. The right route, which is subcutaneous, and the right time, 14:58. So I did my 3rd check for this one. So now I'm going to go ahead and position the patient in the position that I want them. I'm going to start with the IM injections. I'm going to go ahead and do it in her deltoid. So I'm going to have her sitting up. I'm going to have her arm relax. I'm going to have her relax her arm. I'm going to go ahead and scan her ID band and then scan the medication. And then I'm going to do started and all that. I'm going to document that I started the medication. And then I'm going to do the same thing with the vitamin B12. I'm going to scan her armband, and then I'm going to scan the medication, and I'm going to do started. And then I'm going to go ahead and, like I said, position her how I want her. I'm going to have her sitting up. I'm going to use this as my fake patient right here. So this is her arm right here. So for the IM injection, we're going to use the Z-track method. So that means I'm just going to displace the skin to the side, go in at a 90-degree angle, and then inject. So I'm going to go ahead and wash my hands. I'm going to apply my gloves. I'm going to cleanse the site with an alcohol pad. I'm going to go in a circular motion, starting inwards and moving outwards. So I'm going to circularize and go outward in concentric circles. Okay, and then now once I've cleaned the area, I'm going to allow it to dry. I'm not going to fan it dry. I'm not going to wipe it dry. I'm going to just allow it to air dry. And then once it's air dry, I'm going to uncap my needle. I'm going to set this to the side. I'm going to displace the skin, so that just means pull it over to the side, hold the muscle back. I'm going to insert at a 90-degree angle, like a dart, so nice and quick. And I'm going to hold it steady and slowly inject the medication because we want it to absorb into the muscle, so I'm going to go slow. Take like 10 seconds to inject it. And then once I have it all injected, I'm going to hold here. I'm not going to pull the needle out. I'm not going to let the muscle go. I'm just going to hold for 5 to 10 seconds and let it, absorb into the muscle. Then once I wait 5 to 10 seconds, then I'm going to quickly pull the needle out. I'm going to let my hand go, the muscle go, and then I'm going to cover it with a gauze pad and have the patient hold. And then while the patient is holding, I'm going to engage the safety device. I would normally engage the safety device, but because I have to reuse these needles, I'm going to do the 1 scoop method to recap it. So I did the 1 scoop method. And then once I have engaged the safety device, I'm going to put it in the sharps container. So now that that one is done, I'm going to go ahead and move on to her subcutaneous injection. Then I would lay her down. I would have her, cover her lower half and expose her abdomen. Then again, I would clean the site in concentric circles, starting inwards, outward, and moving outwards. Then I would grab my vitamin B12. I'm going to set this to the side. And for the subcutaneous injection, we're going to pinch the skin this time. So I'm going to grab I'm going to pinch a section of her abdomen right there by her umbilicus, 2 inches away. Pinch it nice and good. To get that fat. I'm going to go in at a 90-degree angle again, like a dart motion, quickly. And then I'm going to hold it steady, release the skin, hold it steady, and push down slowly again. Okay, now that I've injected, I'm going to pull out quickly. And then again, I would normally engage my safety device, but because I can't, I have to reuse the needles, I'm just going to do the 1 scoop method. Okay, once I have engaged my safety device, I'm going to throw that in the sharps container as well. Now that she's had both injections done, I'm going to go ahead and monitor her and make sure her injection sites, I would have her hold gauze there too, so she would have 2 gauze holdings. And then I would tape those up, band-aid them, do whatever I need to do. So then once she has all the injections given, I'm going to monitor her sites, make sure they don't have any adverse reactions like swelling or redness or anything like that. So I'm going to monitor her injection sites. And then while I'm monitoring her, I'm going to go ahead and remove my gloves. I'm going to go ahead and perform my hand hygiene. I'm going to throw all my trash away. Then I'm going to go ahead and document that I gave the medication. I'm going to document in there that I finished the medication. So for the vaccine, I'll go ahead and do given, and then I will document where I gave it to her. So in her right or her left deltoid, whichever one I gave it in, I would document any assessments that I did for her, and then I would also document that lot number that was on the vaccine. I remember saying that we had to document the lot number. So I would document the lot number as well. Then I would go ahead and document that I had given her her vitamin B12 shot. I would document where I gave it to her, so in her right or left abdomen or any of the other alternative sites. And then I would also document any assessments that I did for that one as well. So once I have them documented, I would go ahead and make sure the patient is comfortable, ask her if she needs anything before I leave, assess for her safety, make sure the bed is in the lowest position, the arm rail is all the way up, she has her call bells, if she needs a walking aid to get to the bathroom or anything, it's near her, she doesn't have any tripping hazards on the floor. So I would assess for her safety. Then I would go ahead and open the privacy curtain, open the door, sanitize my hands, and then exit the room. And that's it. Thank you.